Good afternoon, everyone. Thank you all for being here. My name is Kai Belton, State Representative for the 100th District, Middletown. I currently serve on the Appropriations Committee, Committee on Children, and Vice Chair of the Public Health Committee. I am also Chair of the newly formed Black Maternal and Infant Health Caucus that I'll share more about a little later. So I would introduce all of my colleagues, but I can't because there are so many of them. But what I will say is I'm a part of many different caucuses, and I really see them showing up today. The Black and Puerto Rican Caucus, the Reproductive Rights Caucus, Bipartisan Women's Caucus, and of course, the Black Maternal and Infant Health Caucus. Thank you all for being here. I think this shows that, sometimes we might not align on, some issues, but this is obviously an issue that we really care about, and we support each other and we work together, and I thank you all for being here. I also want to thank some organizations that I see in the room: PSI Connecticut, YWCA, Hartford Healthcare, and if I'm forgetting you, just thank you for being here as well. So the purpose of today's press conference is a few things. And I want to go back and say thank you to the Hispanic Health Council because we had to shift things a little bit to celebrate today as Maternal Health Awareness Day. And they were very collaborative and shifted along with me. So I thank you for that. And with that being said, I hope that many of you can stay until the end of the press conference because they will be speaking a lot about their bill towards the end. So today we are going to recognize Maternal Health Awareness Day, introduce the Black Maternal and Infant Health Caucus's missions and priorities, and last but not least, talk about the Hospital Accountability Bill that's been proposed by the Hispanic Health Council. So today marks the 5th National Maternal Health Awareness Day, which is dedicated to bringing attention to the unique health struggles faced by mothers and birthing people, both physical and mental. And it started in New Jersey in 2017 before becoming nationally recognized. And our Governor Ned Lamont has officially proclaimed January 23rd in Connecticut as Maternal Health Awareness Day, and we have our proclamation here. So now that we have that business out of the way, the United States continues to have the highest rate of maternal deaths of any high-income nation, and the rate is by far the highest for Black women. Most of these deaths are almost 100% preventable, and nearly half of maternal deaths occur between 7 and 365 days postpartum. When giving birth should be one of the most joyful and beautiful moments for families, sometimes it's not, and especially for women who look like me. It can truly be a death sentence. Black women are 3 times more likely to die from a pregnancy-related cause than white women in the U.S., and are also twice as likely as white women to be affected by potentially life-threatening conditions or complications. And Connecticut has a reputation of being one of the healthiest states, and yet has significant maternal health disparities. And these inequities are deeply rooted in racism and discrimination. And research indicates that racism and chronic stress adversely affect maternal and infant health outcomes. And this is why we are all here today, standing in unity. We have made some strides here in Connecticut to improve maternal health. We've passed the Pregnancy and Postpartum Support Act, expanded Medicaid coverage for postpartum care, established the Maternal Mortality Review Committee, passed the Infant and Maternal Health Equity Bill, passed the Midwifery Modernization Act, and passed the Paid Family and Medical Leave Act. So we need to clap for that. But we obviously still have so much more work to do. So at the end of last session, the Black Maternal and Infant Health Caucus was formed. So the Black women legislators felt very passionate about creating a space where we could really and truly focus on changing outcomes for Black mothers and birthing people. And in conversation, we were able to share stories, some very traumatic, about ourselves, about our family members. And I want to acknowledge those members. It's myself, Representative McGee, Rep. Walker, Rep. Exum, Senator Miller, and former State Representative Robin Porter, and former State Senator Marilyn Moore, who I want to say both worked tirelessly on this issue, by the way. And we are continuing the journey of the work that the two of them have done to improve maternal health care in our state. So when we created this space, we wanted to invite other legislators to join, and we have a bipartisan group of 22 members. We actively meet, we actively give input on how we can improve outcomes for our state, and it is a caucus that I am extremely proud of. The purpose of the caucus is to advocate for equitable healthcare access, improve maternal and infant health outcomes, and reduce the unacceptably high mortality rates within our community. And through collaboration with healthcare professionals, community organizations, and policymakers, the caucus aims to drive meaningful change by focusing on expanding access to quality prenatal, birthing, and postpartum care, promoting culturally competent care and eliminating racial bias in the healthcare system, utilizing data-driven approaches to reduce maternal mortality and morbidity rates, engaging communities in maternal and infant health education and advocacy, and advocating for legislative solutions and funding that support Black mothers and their children. So we have a few priority bills that I'm just going to mention because others will be speaking about them. One is establishing a perinatal mental health task force, which we're in collaboration with PSI Connecticut. A fatherhood initiative, educating and including fathers in maternal care, access to lactation consultants, and last but not least, a bill concerning hospital accountability, which is a significant focus of this press conference, and you'll hear more about it. So at this time, I would like to introduce our Vice Chair of the Black Maternal and Infant Health Caucus. But first, I want to acknowledge that she is a really great partner in this effort. And I shared last session that 30 years ago, yes, I'm that old, I had a child and I was not believed about my pain. And I had that child in my t-shirt at 7 months pregnant, and he was born 2 pounds, 9 ounces. So I'm very passionate about this work. I'm passionate because of my previous experience, and I want to help create a better future.